Hello, everyone. You're live with Jonathan Maness, president of Maness Veteran Medical. And today I'm going to continue my conversation with Dr. Costello about the Diowave. We're going to dig into the AI features and all of the different conditions that it really helps with. So very fortunate to have Dr. Costello with me, and I'm going to go ahead and bring him up now. Hello, Dr. Costello.
Good afternoon, Jonathan. Nice to see you again.
Nice to see you. And thank you so much for taking some time today. What we're doing today is we're educating the VAs, the DoD facilities about all the different capabilities of the Diowave. But today we specifically wanted to dive into the AI features. Can you talk a little bit about that and the ease of use of the system?
Sure. Having tried to train providers on a very new technology, I've seen many of the obstacles that face them in trying to implement it successfully into practice. That is why we developed the artificial intelligence software. The beauty of the software is all it requires is some very, very basic information to be input into the system, and the system will then set all the parameters for the treatment for the patient's specific condition. So basically what happens is the provider enters the patient's name and creates a file. They enter the body area that's going to be treated. They enter the patient's pain level, and the machine will then custom select a dosage to start with. When the patient comes back for subsequent treatments, the software will ask what their response was to the prior treatment. Are you better, the same, or worse? It will then make the adjustments necessary to the dosage and administer the proper dosage based upon their previous response. In other words, the software has the ability to custom tune the laser to the patient's specific condition. It can easily be used. The beautiful thing is, it can be administered by a physician, a medical assistant, and even a patient. Many providers prescribe laser for patients to be treated daily who suffer with severe chronic intractable pain. They can easily use the AI software and continue to administer treatment effectively and efficiently.
And this is huge, Dr. Costello, because every VA and DoD facility that we're speaking with, when you start talking about lasers and technology like this, it becomes a massive undertaking just to train their staff on how to operate the system. This saves time and is very, very effective. And that's what you've seen in the field, correct?
Correct. In other words, they can get positive results with patients on day one. Easy to operate, efficient, effective, right out of the starting gate.
And the big thing with the VA, Dr. Costello, that a lot of people are seeing is, a lot of people are having a hard time getting to the VA. This is a unit where we could place it with certain folks or send it out, and things could be taken care of. The VA could prescribe it for certain patients for all the different things that we have going on. We're about to get into all the conditions that this is helping with, but do you foresee that as well? We can actually train folks to run this on their own or with very little supervision.
Exactly. As I said, patients can be prescribed this unit by their physician, and with a short amount of treatment, they can do daily treatments on themselves, or their spouse can assist, and they can manage their chronic pain effectively and efficiently, and even reduce their dependency on addictive medications.
Maness Veteran Medical has always been about that. Me being an amputee, I'm telling you, I've saw it firsthand. The painkillers, the things that are getting to the veterans, it really does bother me. And that's what's always been at the forefront of Maness Veteran Medical, finding partners like yourself to bring these cutting edge technologies to the VA and to the DoD for all of our veterans out there. So let's talk about all the things that you've seen and you do every day with this laser. What is it helping the most?
Well, let's talk about some very common things such as arthritis. The laser is wonderful at relieving pain, stiffness, limited ranges of motion, and helping to actually regenerate some articular cartilage. Completely safe. They can't overdose. They can't have too much, and can be used on any joint in the body. This is huge, taking these people away from anti-inflammatory medications, which are detrimental to both the liver and the GI tract. So we have an alternative for these people. Again, pre-surgery, post-surgery, or patients whose health condition does not allow them to have a joint replacement, they can effectively be managed and given a better quality of life with the Diowave Stealth Laser System.
Dr. Costello, how many times a week are you seeing that you need to treat each patient? What's happening there?
In the Outpatient Research and Development Center at Florida Atlantic University, we treat 3 days a week, Monday, Wednesday, Friday, and that gives us ample time to get great results for patients with arthritis, whether it be their knee, shoulder, hand, wrist, and fingers, or even elbow, hip, or knee.
And also, let's talk a little bit about the neuropathy side of things. How many times a week are you seeing each patient for that, and how long is it taking to really see some effects?
Neuropathy patients are treated the same. We treat them, 3 visits a week. We start to see changes come pretty quickly, usually within the first 2 weeks. Neuropathy, is an epidemic. 20 to 40 million Americans have it with no treatment except 4 antidepressants, anti-seizure medications, and that's it. There is no other treatment for neuropathy except the laser, which helps to increase blood flow, heal the nerve endings, taking away numbness, tingling, pain, burning, and balance loss, all without side effects.
And one last thing that I've been seeing at the VA, and I just want to have a candid conversation with you about this. In the VA, diabetes is a humongous problem. Can the laser help with the diabetes treatments as well?
Well, again, the diabetic neuropathy, which is a common side effect of longstanding diabetes, is peripheral neuropathy. And yes, the laser can help with that neuropathic pain that inhibits nightly function, mainly sleep. Neuropathy is classically worse in the evening. So absolutely, the laser can be of great effect with diabetic neuropathy patients.
Well, Dr. Costello, thank you so much for your time today. As we continue along our series, we'll do some live showings, in your office if you want to do that. But we're going to continue to tell the world about this outstanding technology. Thank you for your time today, and I hope you have a wonderful day.
Thank you so much. Appreciate it. We'll see you again, Jonathan. Thank you.
Thank you, everybody. So look, I appreciate your time. Please watch this, share this out to all the other clinicians, VA hospitals that you know. And if you need a demonstration or a demo unit, just please email me, the one-leg bandit at manessveteranmedical.com, or call me. We'll get it set up and get it sent right out to you. But Maness Veteran Medical is so very thankful to be at the cutting edge for all of our veterans that are out there. And we love you so very much. So thank you all. Have a great day. Until next time, Jonathan Maness. We'll see you later.